division that's called Housing for Health. And you might wonder, why is the Department of Health Services, whose main task is to operate our public hospital system, getting involved in providing housing? And I will tell you that the reason why is because we come from a philosophical standpoint that housing is a form of healthcare intervention. It's so important that we wish that we lived in a world where doctors could actually pull out their prescription pad and prescribe housing for our patients, because we know it's that important to improving the health outcomes of some of our most vulnerable residents in our community. The goals of our department, Housing for Health, are to quickly create 10,000 units of permanent supportive housing. That's really our main effort, although we also provide rapid rehousing and interim housing, which I'll talk about a little bit later. We do this work also because we're part of a collaborative effort here in Los Angeles County to end homelessness. With some of our panelists here in the room, we've engaged in an effort to do what we can in the fight to end homelessness. We also do this work because we know that it actually helps reduce inappropriate use of expensive healthcare resources. I think some of the other folks today talked about the cost savings that flow from providing permanent supportive housing by reducing things like emergency room visits, incarceration, and a number of other costly county resources. And we, last but not least, do this work because we know that it's really what helps improve the health outcomes of, as I mentioned, our most vulnerable patients in our healthcare system. I'll quickly tell you about how we're doing in our efforts to reach these goals. So our program launched in November of 2012, so we're a relatively new division for our department, and we've provided housing to just over 2,000 individuals. And I think we have some of our service provider partners in the room, so I think it's fair to brag that we have a 96% housing or 12-month housing retention rate, which we're really proud of, well above the national average, and we think that's really a testament to our service provider partners who really embody a whatever it takes approach to helping our participants both get into housing and then once they're in housing to be able to maintain that housing. All right, so I'll talk to you a little about who our program targets. So we're really focused on serving individuals who have physical and or behavioral health conditions, high utilizers of a variety of county services and other vulnerable populations. When we started at the Department of Health Services with our initiative, we really focused on those frequent users of our healthcare system, using healthcare dollars to pay for permanent supportive housing. Since the launch of our program, our goals have really expanded to serve some individuals who are high cost in other systems and who are really experiencing complex health conditions. And I should mention, because of where I'm standing today, that we're really focused on serving individuals who have both physical health, substance use, and mental disorders. That's really the goal here, is to really focus on folks who may be tri-morbid. So I'll also just briefly mention that we have a brand new initiative through the Department of Health Services called the Office of Diversion and Reentry. And the focus of that office is to divert individuals who have a mental illness or co-occurring substance use disorder away from the criminal justice system, with the understanding that our county jail in Los Angeles County has way too many people who have a mental illness and ought really to be in community-based treatment and permanent supportive housing rather than behind bars. When the Board of Supervisors created this office, I think they made a very strong decision, and they said, for this office, we want to set aside 40% of the funds for permanent supportive housing. I like to think it's an enlightened decision because we really believe that permanent supportive housing is that key intervention that will help us to be successful to divert individuals away from the criminal justice system who have a mental illness or co-occurring substance use disorder. In terms of how folks flow into our program, one of the main mechanisms that people access our services is through our county's coordinated entry system, which has been touched on a little bit in each community. we are building a robust system to coordinate these really valuable permanent supportive housing resources. We know that every year the demand for permanent supportive housing far outstrips the supply, so we've got to make sure that as a community we're ensuring that these resources go to the folks who need them the most and who are the most vulnerable. All right, so I'll just briefly mention, I said we do something else called interim housing. There are a variety of names for this. Some people call it bridge housing. What I mean here is that we're providing a place for people to stay before they move into their permanent housing unit. So anyone who comes into our interim housing program is just on their way to permanent supportive housing. We have two different types of interim housing. The first we call recuperative care, and it's really a medically enhanced shelter setting with clinicians on site. This is many of the individuals who are in our recuperative care settings are actually coming directly from our hospitals. So they are individuals who no longer need to be in the hospital, but cannot be discharged from the hospital because they'd be discharged to homelessness. So these are people, where you and I, we would go home to our families who would take care of us. For people who are homeless, they don't have that luxury, so this is an alternative for that population. We also provide stabilization housing, which is a place for people less intense, but a place for people to stay before they move to their permanent unit. Right. So I think for folks, if you weren't familiar with permanent supportive housing before today, you probably are now, but I think you probably got the message that if you're going to do permanent supportive housing, you have to have affordable housing, high quality affordable housing, and then you've got to have those supportive services. So you can't just give someone a key and say good luck, figure everything out, hope you do well, good luck. You've got to have those supportive services to help people to both get into housing and then to address any crises and maintain their housing over the long term. And then the opposite is true as well. You can't just provide supportive services because you can provide supportive services until you're blue in the face if you don't have that housing resource attached to the client. You've got to do both. So we have a service modality through the Department of Health Services that we fund that we call intensive case management services. And every single client who's connected to our permanent supportive housing program has an intensive case management service provider. Their goal really is to create an individualized service plan that's based on client-driven goals. Some of the main things that our service provider case managers are looking at is helping to get our clients connected to a primary care provider and health insurance. Making sure that if they may have a primary care provider, but if they're not actually visiting that primary care provider, what can we do to ensure that any of those barriers are reduced and they're actually getting appropriate care? Equally important is the connection to both mental health services and substance use disorder treatment, so helping our clients to navigate those systems and again, reduce any barriers to entry. The services through our program are either provided on site in a permanent supportive housing, site-based, project-based building, or in scattered site housing, which means that our service providers are in roving teams and they're going out to visit our clients in their homes and their communities. So it's important to note that these are field-based services. Again, very important to the success of our participants that they have someone who can actually come and visit them in their homes. So we've talked a little about the ways in which we are able to access affordable housing in Los Angeles County, one of the most costly places to live in the U.S. And the way that we do that is by connecting our participants with our rental subsidies. So that our participants pay just 30% of their income towards rent, and the rest is covered through a rental subsidy. So in Los Angeles County, historically, we've relied on rental subsidies that flow to us from the federal government. We will never stop fighting for more rental subsidies to come to Los Angeles County. We will take all the data that we can to DC to ask for more services, more subsidies to help us address this homeless crisis in LA County. But we also realized that we may need to put our money where our mouth was and create. What we did is we created a locally funded rental subsidy, and we call it the Flexible Housing Subsidy Pool. And we call it flexible for a couple of reasons. We created the subsidy in such a way that we can serve individuals who may not be eligible for those federal rent subsidies, and that includes individuals who are undocumented or individuals who have a criminal record that may make them ineligible for a federal Section 8 voucher. The other way in which the program is flexible is that we can procure all different types of housing resources. So we can do 100-unit project-based buildings with an incredible level of services on site, or we can go out and use the rental subsidy in a tenant-based fashion and work with mom-and-pop landlords or with big property management companies. Basically, the goal is to find as many units as possible. I often say, with a crisis of this scale, we've got to leave no stone unturned, and so we're always looking for innovative and creative ways to produce net new units of housing here in Los Angeles County, so we're not just fighting for what's already there. The Flexible Housing Subsidy Pool, what we launched it in 2014 here at DHS. We started with an $18 million fund with a $4 million seed grant from the Hilton Foundation. Again, we can do all different types of supportive housing. What I should also mention is that the Flexible Housing Subsidy Pool is just one of the tools that we have in our toolkit. So it's one of the mechanisms that we use in Los Angeles County and through the Department of Health Services. The rental subsidy itself is operated by a nonprofit entity called Brilliant Corners, and they play a really unique role for us in that they help us in the super tight housing market to find units. So they're out there pounding the pavement looking for units for this particular program. They then enter into an agreement with a property owner or a landlord to make that unit available to one of our clients, someone who's homeless. Brilliant Corners also runs a 24-hour crisis line. As you can imagine, sometimes landlords have some concerns about a perceived risk associated with providing housing to one of our clients, so we're able to assure them that we'll be there, we won't be leaving anybody in the lurch, and we're making sure that our client is well connected to a variety of supportive services. Brilliant Corners also provides housing retention services. I tell you what, this is oftentimes landlord mediation, making sure that any issues get addressed right away. And then, of course, last but not least, the rental subsidy operator is responsible for actually making those on-time rental subsidy payments each month to our participating landlords. So to do this, basically, we've got the funder, the Department of Health Services. We've got Brilliant Corners, who's out there connecting, finding landlords, and then obviously we couldn't do this without the landlords in our community who are willing to be a big part of ending homelessness in our county. I heard that you all talked a little bit about whole person care yesterday, but I'll just briefly mention that in Los Angeles County, our whole person care application, which is our Medicaid waiver, counties we're invited to provide an application to the state to use Medicaid dollars to do creative things to serve people who are our highest risk, highest need Medi-Cal beneficiaries in Los Angeles County, particularly those high users of various systems. And we in Los Angeles County decided that we would write into our application a really significant proposal around ending homelessness. So the funds that we put into the type of programming that we built into our application includes funding for those really important supportive services, sobering centers, and other, Maria talked a little about these street-based engagement teams, but multidisciplinary street-based engagement teams as well. So we're really excited about the opportunity to have some new funds to help us expand this work and really make an impact in ending homelessness in LA County. So to close, I just want to say that with these new investments and with our very ambitious goals of the Department of Health Services to end homelessness, for those who are already working in this field, thank you so much. And for anyone that's considering, making this a part of your profession, we really need you. We need really strong fighters and advocates for this particular population that is so incredibly vulnerable. So thank you so much.